Good afternoon, everyone. This past Friday, I joined Dr. Arwady to announce some steps we'll be taking to safely move our city to phase 3 of our reopening plan. A move that we'll only make based upon the science and the data of COVID-19, meaning we will only move when we have hit our metrics that we outlined a few weeks back. And these criteria include declines in case rates, having adequate support systems for our vulnerable populations, assurances that our healthcare system can handle the very real possibility of a case surge, and having adequate testing and contact tracing resources to track and limit the disease's spread, which is what brings us here today. One of the most important weapons that we have in this fight is contact tracing, which is our ability to follow the path of this disease in order to learn where it's coming from, who's getting it, and how it's spreading in our communities. Since the beginning of this crisis, Dr. Arwady and her team at CDPH have done amazing work in conducting case investigations. That's finding information about the specifics of a person who's been affected, as well as doing contact tracing. But we know that we need to exponentially ramp up our contact tracing itself. And that's why I'm thrilled to announce a new $56 million RFP to expand contact tracing in Chicago. Yes, $56 million. The RFP will be awarded to a single lead organization, and 85% of the funds, which come from the CDC and IDPH, will be directed to support at least 30 organizations that are either neighborhood-based or primarily serve residents of the communities most impacted by COVID-19. These organizations will be responsible for recruiting, hiring, and supporting a total of at least 600 new contact tracers, supervisors, and referral coordinators across our city, all of whom will ultimately be able to trace 4,500 new contacts per day when fully ramped up. Most of these jobs will last 18 months, and we are talking about good-paying jobs here, with contact tracers making $20 per hour, supervisors making more, and all with health benefits. This RFP will be open. It's opening today, and it'll be open through June 19th, and can be found at our website, chicago.gov/coronavirus. But this RFP is about more than just new contact tracers, and about more than even COVID-19 itself. It's about expanding health equity in our city. The discrepancies we've seen with COVID-19 in our African American and Latinx communities didn't just start with this disease, as we all know. They are, in fact, the direct result of generations of disinvestment and neglect that have expressed themselves most recently in the pre-existing conditions COVID-19 preys upon. Over the past 2 months of this crisis, we have worked to address these discrepancies with initiatives like our racial equity rapid response teams, our new community-based testing sites, and now today's RFP. But while these efforts are focused on COVID-19, they are in fact the latest steps in our broader mission to close these community fault lines once and for all. That's why, in addition to expanding contact tracing in these communities, this RFP will also provide earn and learn opportunities to promote career pathways and real long-term growth for our community-based workforce within the healthcare economy. Even in the face of this crisis, we need to leverage every opportunity we can to grow, build, and recover in ways our city has never seen before, and become the inclusive, equitable, and supportive city we all know we can be. These communities this RFP will be focusing on were chosen because it's there where these fault lines are most pronounced. Whether with COVID-19 itself or with long-term conditions like diabetes, obesity, heart disease, and cancer, all of which are closely linked to core determinants like access to healthcare, education, and jobs. I'm proud of our efforts to ramp up contact tracing in Chicago, which, as I mentioned, is a critical tool in stopping the spread of COVID-19. But we can't do it alone. This has to be an all-hands-on-deck effort involving hospitals, federally qualified health systems, and others who will be working closely in coordination with CDPH as they take on case investigation and contact tracing roles as part of their own priorities for their patients. These include organizations whose members are standing with me now. We have a representative from Howard Brown Health System, Mr. Schneider. Rush University Medical Center internist Elizabeth Davis, U of C Medicine's Chief Diversity, Inclusion, and Equity Officer Brenda Battle, and Helen Margalos, Senior Research Director and Senior Epidemiologist of the Sinai Urban Health Institute. We are all tremendously grateful that these groups have stepped up for their city. And let me just say as an aside, all of these organizations who are here with us today, all the ones that I've identified, have been fighting the fight of healthcare disparities for a very long time. We are grateful for all the work that you have done, and we welcome you as part of this expanded partnership. I've said to my team all along on a range of different issues, we can't be focused on building temporary scaffolding. We've got to build foundations for the work that needs to be done now and into the future, and I am grateful for all that you're doing every single day in your communities and the people's whose lives that you are changing for the better. So thank you so much for being here. At this point, I will now turn things over to Dr. Arwady, who will discuss the RFP in more detail. She'll be followed by Dr. John Snyder of the Howard Brown Health, Dr. Elizabeth Davis of Rush, Brenda Battle of U of C Medicine, and then Helen Margalos of Sinai Health Institute. Dr. Arwady.
Thank you, Mayor, and thank you to all of our partners for being here today. So I'm really proud to talk about how we are taking the scaffolding that the mayor mentioned to really think about our response to COVID, not just as an immediate response, but as a way to grow our public health infrastructure and to build economic opportunities that will give people the opportunity to earn as they learn. So that, yes, we are thinking about contact tracing, meaning reaching out and limiting the spread of infection, and I'll talk more about that in 1 second. But also, we're thinking about really offering some entry-level jobs that people will, at the same time as they are doing this important work, get additional training. This will be done in conjunction with city colleges, as well as the Chicago Cook Workforce Partnership. And we think about taking individuals who have an interest in promoting health in their communities, doing the contact tracing initially, but building skills that over time, our hope is that these folks can move on to become the sorts of health coordinators that we want to see, pulling together social service needs, health needs, really making sure that people who have often had trouble having their needs met to be as healthy as they can be, making sure that those needs are met. Secondly, we want to help people build skills that will ensure they can have longer really jobs that will let them build a career in healthcare and in public health, in community health worker and other related opportunities. And so what we'll be doing, first of all, is the case investigation work. If folks are not very clear on case investigation, this is the work that the health department does year-round, every day, and has for decades. Every time someone is diagnosed with tuberculosis or measles or HIV or any of more than 70 other infectious diseases, people from the health department reach out confidentially to the person who has been diagnosed. We've been doing that from the beginning for folks who have COVID-19. We reach out, we connect, and we say, what are your symptoms? Do you have care? Do you have what you need to make sure that you can recover from this disease? But also, let's talk details about where you have been and who your contacts might have been, who you could have potentially exposed to that disease. And so for COVID, for example, we really go through some detail. When did you get sick? But then not just when did you start really feeling sick, when did the symptoms actually start? And then because we know that people are able to spread COVID in many cases for a few days even before their symptoms start, we go back even a little further than that. We speak to them and get a list of anyone who has been in close contact, within 6 feet, especially for more than 10 minutes, especially without wearing those face coverings. So that would be people especially who share a household, but it could be people at work, it could be people riding in a car, it could be people if you've been out and about. The idea is to get that list. That case investigation work finishes. The information goes into a secure database, and then separate from this, we have contact tracers. And the contact tracers have the list of the contacts. So not the people who have been exposed and have been infected with COVID, that's protected health information, but the whole list of, so if I had been diagnosed with COVID, for example, I might say, here's the person I rode in the car with, here's the person who lives in my household, here's the person who I worked really closely with at work. The contact tracer is then reaching out to that person who rode in the car with me or that person from my workplace and saying, we have reason to believe you have been exposed to COVID-19 without ever naming me as the case patient, without ever being explicit about the way that they could have been exposed, but to work with that contact to then say, it's very important because you've been exposed, you need to then quarantine. You need to also think about not spreading disease further. We need to make sure you're connected to care and other resources that you may need, and we need to follow up and check in with you to see if you develop symptoms. We need to make sure if you get tested, particularly if you do develop symptoms, and we want to make sure that we're following along with you to help limit the spread. The health department has been doing this work from the beginning, but when we're still getting nearly 1,000 cases a day, 2 days over this 3-day weekend, we had nearly 1,000 new cases per day. We've not been able to do the full extent of the case investigation and contact tracing. We've been building up capacity within the health department first. We're now pulling in people from other city departments with appropriate training, and many of our clinical partners here have also stepped up to make sure that especially that initial case investigation can be done quickly and effectively. You have to pair case investigation with appropriate resources for isolation, for quarantine, for food, for shelter, for whatever people may need to ensure that we can limit disease. And so as part of this RFP, the goal is to take what we've already been expanding here within the city structure. We've got volunteers, we've got a lot of people who have been a part of this, and moving it into more of a long-term structure that allows us to work with community-based organizations, especially in the neighborhoods of high economic hardship in Chicago. So I want to be clear that the contact tracers and the resource coordinators who will ultimately be doing this work will be doing the work for everybody in the city of Chicago. This is a phone-based call. The resources are available, so it does not matter where someone lives in Chicago. They will get the same speed and the same attention in terms of the case investigation and contact tracing that's needed. But we want to work with the community-based organizations that are in these areas of higher economic hardship, because that is where there's an opportunity to also grow in an economic way and in a way that lets us build up a capacity for community health work that we hope will long extend beyond the COVID response. We've had a goal with our Healthy Chicago 2025, for years now to really close the life expectancy gaps in Chicago, the racial life expectancy gaps, and a lot of that is based in decades of disinvestment, decades of difficulty not only accessing health care, but accessing some of the basic human needs that a lot of us take for granted. And this is one opportunity to take funding that is directed toward the COVID response, use it to first and foremost contain COVID in Chicago, but secondly, set the beginnings of what we hope will move from a COVID contact tracing core to really more of a healthy Chicago core, and be a place for long-term growth and improved health equity in Chicago. I'm sure people will have questions, but I want to make sure that I leave time to hear from the partners who have already stepped up to help fill in as part of what will be an all hands on deck for a long time here to keep us going and to keep improving what we're doing, getting COVID under control, and thinking beyond COVID to a healthier Chicago. So next I'll bring up Dr. John Schneider from Howard Brown Health.
Thank you, Mayor Lightfoot. Thank you, Dr. Arwady. So I'm just going to give a little bit of background about how Howard Brown Health started doing contact tracing. We had our first identified COVID case in March of this year, March 13th, 2020. And we quickly mobilized our existing contact tracing staff, which were doing contact tracing for HIV and STDs, to start working on the COVID contact tracing. We've kind of ramped that up quickly. We got a lot of volunteers. We relied also on the Latinx Medical Student Association. We got into some pockets of Spanish-speaking communities. And so we've rapidly expanded our workforce to now 40 people working on contact tracing. 3/4 of them are bilingual. I think, so we've initiated contact tracing on close to 2,000 people at Howard Brown Health, and we have, a robust, energetic, empathic workforce. And so I think that for a lot of the agencies working for this RFP, will be identifying empathic, caring people to work in these communities. I think, an example of how this works, we have a new contact tracer, Louis Spraggins, who accounted a call he made to someone who had been diagnosed 2 days earlier, and that individual was on the bus going to visit their aunt. They got off the bus, went back home, didn't visit their aunt that day, and importantly, they were appreciative. And the reason they were appreciative was not because there was this sort of big brother, get off the bus, go home, but it was an empathic conversation. Louis discussed other resources that the individual could obtain, things like health insurance, employment assistance, and other things. And so I think one of the main pieces of this that I think we need to remember is that we can contact trace people, we can make nice visuals of the networks and things like that, but what's important is really to meet people where they're at, offer resources. This is maybe a gateway into primary care across the city of Chicago, and also dispel misinformation. First thing someone does when they get COVID is they go online, get a lot of misinformation, and so we come a couple days later and try to work through some of the questions that people have. So those are my comments, and I thank the mayor and the leadership that the city is having in this area.
Thank you.
Oh, Dr. Liz.
Thank you. And I'd like to thank Mayor Lightfoot and Dr. Arwady for your inspiring leadership during the COVID-19 pandemic. Rush and our partners at UI Health, led by Dr. Stockton Mayer, have been on the front lines every day in congregate settings, as Mayor Lightfoot and Dr. Arwady mentioned. We do this because through our work in congregate settings, which are places like homeless shelters where multiple people live in one space, and through our work in those settings, we've seen encouraging results in the fight against COVID-19. A key piece of this strategy is that when one person tests positive in a congregate setting, such as a homeless shelter, our team shows up and tests everyone in that shelter, including both staff and residents. Because in a congregate setting, especially one like a homeless shelter, everyone is a contact. We then are able to isolate people who test positive, some of whom would not have known otherwise that they had COVID, and we are able to get them the care that they need. And then that way we can protect the remaining people at that shelter from contracting COVID. Through these steps of testing, isolating, and using infection control practices like universal masking, we've been able to stop outbreaks in the facilities where we've tested. The majority of the people who we have tested are people of color. This reflects the homeless population in Chicago, which is disproportionately African American and Latinx. So stopping outbreaks in these congregate settings is an important piece of improving racial health equity in our city. Our work in congregate settings has only been possible through partnership with multiple different healthcare and social service institutions, with leadership from the Chicago Department of Public Health and the Department of Family and Support Services. And we want to thank all of our partners for coming together in order to make this work happen. So thank you. And I'd like to introduce, thank you, Dr. Brenda Battle.
So I also want to thank Mayor Lightfoot and Dr. Arwady for your incredible support in this work and your leadership. So the University of Chicago has been actively working over the last several weeks to stand up testing sites across the South Side, including on our campus, in our Hyde Park campus and our Ingalls campus in the Southland, with drive-up and walk-up testing sites. But we've also been working with the federally qualified health centers and the hospitals on the South Side of Chicago to stand up testing sites at their sites. So as a result, we've stood up 10 additional testing sites by working alongside providing technical support, consultation, and testing for our partners on the South Side of Chicago. We most recently stood up a site with Friend Health in Auburn Gresham, one of the highest hit areas on the South Side. And we're very proud that we're in the process now of standing up a site in South Shore, along with Friend Health. And as other speakers have indicated, as we increase testing, it's imperative that we also to begin identifying persons that have been in contact with individuals who tested positive for COVID-19. So we recognize that contact tracing is historically not a health system endeavor, but mostly a health department endeavor. But we realize that in this unprecedented time, that it's really all hands on deck and that we've all got to be involved in this process. So on the South Side, nearly 77% of the population is African American, 12% is Latinx, and many of them have already been impacted by COVID-19. It's critically important for us that we participate in contact tracing to support the city's strategy in reducing the spread of COVID-19. As such, the University of Chicago will begin contact tracing in the very near future, focusing primarily on patients who've tested COVID positive at the University of Chicago Medicine and those who've tested positive within federally qualified health centers that are part of the network of providers on the South Side of Chicago. We've been in very close contact with CDPH and will align all of our efforts with those of CDPH, ensuring that our processes, our protocols, and our reporting are consistent with what the state is doing. We appreciate the guidance of CDPH, and again, we thank the mayor and we thank Dr. Arwady for your support. Next, we're calling Helen Morgelis from Sinai Urban Health Institute.
Thank you.
Hey, good afternoon. I also wanted to thank Mayor Lightfoot and Dr. Arwady for their wise leadership through this crisis and for being forward-thinking and proactive in putting forth a response that's centered on health equity. Sinai Urban Health Institute is the community-engaged research arm of Sinai Health System, and we have been working closely with Chicago's West and South Side communities for over 20 years to better understand health inequities and to develop, implement, and evaluate solutions that move us towards health equity. SUHI, as we call ourselves, is an innovator and respected leader in the training, hiring, and supervision of community health workers. We've successfully developed and implemented effective CHW-centered health interventions for a variety of populations and organizations. For those of you that may not be familiar with CHWs, the American Public Health Association defines a CHW as a frontline public health worker who is a trusted member of the community that they serve. A community health worker therefore serves as a liaison between health and social services and the community to facilitate access to services and better health. Through our Center for CHW Research, Outcomes, and Workforce Development, or CROWD, Sinai Urban Health Institute provides community health worker training and consulting, building on 2 decades of direct experience in developing, utilizing, and evaluating the CHW model. As you've heard, the goal of the City of Chicago in this effort is not just to hire contact tracers, but to ideally train a workforce that can fill that role now and then transition to CHW or other healthcare and support positions later. Consistent with the city's efforts in Healthy Chicago 2025, CROWD's model will help enhance workforce capacity and ensure this effort is more than a one-and-done opportunity. With the onset of COVID-19, SUHI, CROWD, and our CHW team worked quickly to transition our services to be responsive to the emerging needs of our patients, community members, and to the CHW's delivering services in a challenging new environment. We have developed and delivered a COVID-19 response training for CHWs and others supporting patients with their health and social needs. We have dedicated SUHI's CHWs to follow up with Sinai Health System patients diagnosed with COVID-19 once they are home. This includes patients who are admitted and discharged from our inpatient units and those discharged home from the emergency department with less severe symptoms. Our CHWs assist with social needs, support patients in following their discharge plans, provide needed social support, and communicate back to Sinai's clinical teams as needed. We're also working very closely with Sinai Community Institute, which is Sinai Health System's social service arm, to pilot a contact tracing program in North Lawndale focused on high-risk youth populations. CROWD will be providing training for the contact tracers, and SUHI will evaluate the initiative so it can be scaled and replicated as necessary. This is really a long-term investment in social justice. It is a critical investment into workforce development and employment opportunities for communities that have suffered historically from disinvestment and high unemployment rates. We are looking forward to working together to build a workforce not to just respond to this pandemic at this moment, but also to have the skills and training that will make them valuable and marketable in the environment that will evolve out of COVID-19. Sinai Health System and Sinai Urban Health Institute look forward to continuing to partner with the City of Chicago and CDPH in the pandemic response and in efforts to eliminate health inequities. At this point, the mayor will take your questions.
Thank you. Good afternoon, Dana.
I'm going to start on topic. I have a lot of questions, so
Okay.
I'll try to get through them. The first is from AD Quigg regarding the $56 million. Is it all from the CDC and a pass-through at IDPH, and will 85% of that $56 million be going to those community groups discussed?
So let me start, and then I'll have Dr. Arwady. Yeah, our plan is that the lion's share of those resources will be going to the community groups that'll actually do the recruiting, the vetting, and then working with individual community members who are going to be part of this expanded contact tracing infrastructure. And I'll let Dr. Arwady take the question of the source of the funds.
Sure. So yes, the Chicago Department of Public Health received funding from the CDC through what's called the Epidemiology and Laboratory Capacity Grant that is meant to, in part, help support contact tracing. So we just received notice of that award on Friday, worked very quickly to be able to turn some of that around. The second portion is funding through the Illinois Department of Public Health. That is also federal funding at its original base, but it is an award through the state to support contact tracing at the local level. So we've been really excited to be able to put some of this funding out to be able to support community-based organizations and add to all of the work that we've already been doing, and this allows us to do that.
Okay, next question is from Becky Vevia at WBEZ. How many contact tracers does the city currently have, and how long will the city be staffing up to do contact tracing through the end of 2020, through the end of 2021?
So we have a number of people that are already engaged in contact tracing. We are taking city workers and repurposing some that are available to really kind of expand the first stage of the increased number of contact tracers. I think our hope is to have this next tranche of folks identified and trained so that they can begin in August. And, you know, as both Dr. Arwady and I said, and I think is borne out in the statements of the folks who were here, this isn't about just a short-term project. We want this to be a career path for individuals to get the training and then see that there are other opportunities for them in healthcare. And for me personally, I think the thing that's exciting about this is if you look at the places for which we're hiring, obviously we're focusing on areas where people are struggling with employment. And so I think that's one of the best things about this. But the other piece is from these same areas, you see significant healthcare disparities in part because they lack access to health care. So if we train up a legion of people from these same communities where there are health disparities, by virtue of the fact that they're involved in health care, their neighbors will know that they do this work, their family members will know that they do this work, and we hope that one of the residual benefits is really demystifying the healthcare system so that people understand that they can be engaged with the healthcare system on a preventative basis and not just when they're urgently ill and then showing up in a hospital emergency room. And Dr. I don't know if you want to add to that.
Yeah, I'll just add that, so first of all, at Baseline, obviously we repurposed just about all of the contact tracing work that the health department does at Baseline. We do occasionally continue to have other outbreaks, and so we sometimes, we have additional work that we need to do. But we took our 35 or 40 sort of contact tracing people at Baseline who typically work in communicable disease, added onto that many other folks from within the health department, so pulled people who would normally be doing HIV work or maternal child work, but that same kind of outreach piece, have been building in that space. And then beyond that, we have pulled in folks from around the city. So we know that there are other city workers. Some departments are not working as much right now, and so there was some opportunity to pull people in there with training. But then we've been doing all of this partnering already and are continuing to build it, especially with our clinical organizations. So the way we're really trying to think about this is meeting the needs and growing with this to meet the needs that we have right now, but in a way that allows us to expand or contract depending on what happens with COVID over the next really 2 years. And so if you look at the language of the RFP, we talk about training these folks as the contact tracers and as the referral coordinators, but that depending on what is happening with our numbers, we've already thought about other ways that we could use them or other ways that we could expand. So in the same way that we'll be partnering with clinical organizations, schools of public health, et cetera, and we've got some of this sort of additional workforce here, we can expand or contract that. We similarly are looking to be able to expand or contract, but have that more in these community-based organizations. So I feel very good about where we are now and very good about the ability to add hundreds more people to this workforce this summer.
And with that, this question from John Byrne. Based on Chicago's population, experts say the city should have a team of at least 810 contact tracers in place before the economy reopens. What's the fastest this RFP can be filled and these 600 contact tracers can be trained and up and running? Will it be before the city's economy reopens? And will this group of 600 bring Chicago's total number of contact tracers up to 810 or more?
First of all, the city's economy is open. It's never been entirely shut down. So that's a little bit of a misnomer and a question. As I indicated, we are adding to the resources that are already available in CDPH and expanding other people within CDPH, and then layering onto that individuals who are coming from other city departments that are going to be joining this team. And in fact, I believe that there's a training session that's happening even today to stand up even another group of people that are going to be. So we're going to continually be adding on to it. We feel comfortable with the sequence that we have, and then the new group that will be onboarded by August. I feel comfortable with that work.
So is August when you think the 600 contact tracers will be up?
I believe that's yeah.
Yeah, there's, so, I mean, we already,
Talking about the new tranche of.
Yeah, the new folks that will be coming through this RFP, just with the timing of how it works, we've basically, this RFP is for the overarching organization who will then be working with 30 subdelegates. So we've put August 1st as kind of the first deadline in terms of having a certain number in place, and then September 15th as the second deadline to have even more in place. But I want to be clear that we are not waiting to do the work of contact tracing. We're combining sort of the expansion that we're doing now, but of course the hope is that the city workforce, for example, will go back to doing the work of the city. Our clinical partners will, be able to expand and contract as is necessary. And obviously CDPH continues to need to not completely stop responding to other responses. And so the idea is we're expanding in the meantime. This will help us hire even more on. But having, we are aiming toward that goal, but we're not seeing having to hit that exact number as a particular milestone in terms of moving ahead, for example, through the phases. We want to make sure we have the capacity to meet the responses where we need to. We've put a lot of focus initially, of course, into these congregate settings, as you heard. And so in those settings where both the health department and partners, we said this is where we really want to double down on case investigation and contact tracing first. We've been successful and actually gotten our positivity down even below the numbers that we're now seeing in the community. And so that's been very successful, where we've pushed that particular piece of contact tracing and case investigation. We're now expanding that out. So when I look at sort of moving through the metrics, if you look at what we use, we talk about it having expanded systems in place and being able to push resources to where they're most needed. And I'm really confident that we are making excellent progress on that and will continue to.
Okay.
And Dana, if I can just add, the premise of the question is basically we're starting from zero with contact tracers. That's just not right. As now Dr. Arwady has said multiple times, and I have said even today, we already have a significant core of people who do contact tracing as a matter of course. That's the bread and butter of public health. So whether it's CDPH, whether it's Cook County, whether it's IDPH, that work is done in addition to the work that's being done by a number of different healthcare providers. What's different about this RFP is that we're expanding that base exponentially through this RFP.
A question from my colleague at CBS2, Tim McNicholas, regarding contact tracing jobs. You mentioned city colleges will be training, but will applicants maybe outside of city colleges have to take an online training course, perhaps through Johns Hopkins or Oakton Community College or somewhere else, or will all this be done within the city colleges and within organizations? Well,
the training is going to be on multiple levels, and again, I'll defer to Dr. Arwady to get into the specifics, but the issue that we're talking about regarding regarding community colleges is to earn and learn, so they'll get a specific kind of certification, and then that will be hopefully a pathway for them to have long-term involvement in community health work, which I think is critically important. Doctor, I don't know if you want to add to that or not.
I'll just add, just to be clear, that there is no requirement for any particular training to be eligible to be hired, related to specific training of contact tracing, to be able to be hired by one of the subdelegates. There will be extensive training, of course, as people are hired to ensure that they have the competency within, for example, the data platform that CDPH will be using across all of these subdelegates to ensure that all data is being collected appropriately and getting back to where it needs to get. So there will be training on the job, if you will, and obviously in addition to the work of the contact tracing to this point, really trying to take the opportunity to build up people who hopefully will want to remain sort of long-term doing this kind of really important community health work. But if you look at the details in the RFP, we've not set any particular requirement in terms of education, for example. We've specifically called out that people who may have previously had difficulties getting employment, whether it's related to prior incarceration or disability or language assets, et cetera, subdelegates who particularly focus on those groups would be of particular interest here. But that'll be sort of in the next piece.
Okay, Mayor, I'd like to...
And if I can just add to that, I want to pick up on one point that Dr. Schneider mentioned. Really what you have to have is a passion and you have to be emphatic. These contact tracers are going to be calling people with information that's going to be frightening and scary to them. And so being a person who recognizes that and understands that they have to treat the person on the other end of the phone with care and with dignity, that's going to be a critical part of it. And again, we will be doing all the necessary training so that people understand the importance and the value of the work and the way in which they need to communicate in these challenging circumstances.
Okay, thank you. I need to move on to weekend violence because I have a lot of questions about it. But first, it was the most violent weekend, Memorial Day weekend in the city in 5 years. So,
I actually don't know that that headline from the Sun-Times is accurate, but look, suffice it to say this. The weekend of violence, and really it was Saturday and Monday. We had a pretty light day on Friday. Saturday was not a good day. Sunday was so-so, but yesterday in particular with 15 shootings was a terrible day. While I know that there was a lot of energy and coordination among a variety of groups, what I said to the superintendent this morning is this was a fail. And whatever the strategy is, it didn't work. And so they're hard at work and looking at the data. I have a meeting with them later this afternoon, but we have to do better. We cannot have weekends in the summer turn into a bloodbath. And this weekend's violence was out of control. And clearly, as I said before, whatever the strategy was, it didn't work.
a question from Franz Bielman at the Sun-Times, and also I'm combining a question from my colleague Chris Ty and myself at CBS 2. Police sources have told us that as a result of the OT crackdown, there were 1,000 fewer police officers on the street over the weekend.
100% not true.
That is not true.
Not true. In fact, there were more officers on the street this weekend. So your sources are incorrect. What we've been doing is pushing organized crime and gangs and narcotics to actually be involved with the district fight, to decentralize them and move them under the control of district commanders and area deputy chiefs. So that's just 100% wrong.
Just to be clear, so there were not 1,000 fewer officers on the street this year compared to last Memorial Day weekend?
No, in fact, there were more officers. Look, these organized crime, which is unhappy about the fact that we've called the question on what their value add is in the public safety fight. They are used to being off by themselves as a separate organization, frankly, with not a lot of accountability. I've been asking for a year, what do they do? And they haven't been able to demonstrate what they're doing to really significantly aid in the crime fight. So what's happened over the last couple of weeks is these officers have either been taken out of plain clothes, put in a uniform, and back in the districts under the control of district commanders and deputy chiefs, or if they're staying in plain clothes, they have to be actively involved in supporting different district efforts at crime suppression. They don't like that, and I get that, but the notion that somehow we had less people on the street this weekend is just fundamentally not true.
This question from Ryan Burrow at WGN Radio. Are you surprised the stay-at-home order isn't having a bigger impact on reducing gun violence in the city? And his second question you've addressed. So that's the question. Are you surprised the stay-at-home order isn't having a bigger impact on reducing gun violence in the city?
No, because you have to think about it in the context, not just of the stay-at-home order. And I've said this many times, but I'll repeat it. What we are experiencing over the last couple months is basically the infrastructure of criminal justice and law enforcement is not there in the way that it used to be, meaning the federal government, the federal agents that are active involved in the crime fight, many of them have been on the sidelines now for weeks. That's a problem. We have the courts that really aren't taking a lot of criminal cases. That's a problem. We have the jails that are effectively closed to new persons. So we have officers that are risking life and limb and arresting people who are absolute drivers of violence, and they're cycling in and out of the jail, out of the court system in 24 to 48 hours. So the pieces of the ecosystem, the infrastructure that the Chicago Police Department relies upon, our partners in this fight, they're not there, or if they're there at substantially diminished numbers and resources, which means the police department really is effectively on its own in fighting public safety across the city. And we have officers, and I understand this, who are concerned themselves with getting COVID and whether or not they're going to be sick themselves or take that to their family members. So this is probably one of the most difficult times for policing that we've experienced in the city, at least in my knowledge of local policing, which goes back 20 plus years. So while we obviously do the year-over-year comparisons, we do the 5-year or 6-year rolling average, the reality is there's no circumstance like the one that we are facing right now when it comes to public safety in recent memory. The only way we start to see and drive down the numbers, quite apart from the police department, is if all the other parts of the ecosystem, not just law enforcement, but law enforcement is important, if they come back online. We can't do this alone solely with the resources of the Chicago Police Department. I've said this many times. What we experience in this city every day with gun violence is a public health crisis. And we have to treat it as such. It means getting at the root causes. That is not a tool that law enforcement can address by itself. It can't. It's never worked. And so law enforcement, of course, plays a critical role, but all of the other resources that need to be there also have a role to play, from our sister agencies, from the libraries, from the schools, from the parks. All of those resources that are available that partner with our police department have been either unavailable or at reduced levels. And so we're seeing a surge, which is absolutely unfortunate and unacceptable, but it's not surprising given that the ecosystem isn't fully operational.
Also from Fran, what about Chance the Rapper's claims that Chicago police were more aggressive enforcing the stay-at-home order in black neighborhoods than they were in white neighborhoods?
You know, look, I understand why people have that concern, but it's just fundamentally untrue. I start out my day doing two things. Number one, looking at the violence numbers overnight, and number two, looking at the orders of dispersal. And I can tell you, based upon the statistics that we've been keeping now for weeks, those dispersal orders are happening all over the city. And yes, in white areas, in Latinx areas, in moneyed areas of the city. Why the media doesn't report that with equal interest? Well, I think there's probably some answers to that. But the reality is that the Chicago Police Department is active and engaged all over the city and doing it with an eye towards equity. And I would have it no other way as mayor of the city.
A question from Sarah Schulte at ABC7. We saw Memorial Day crowds from neighboring states and around the country gathering, and sometimes in huge numbers.
Yeah.
How will the city prevent the same thing when the lakefront opens up later this summer?
Well, that's why we're taking our time with coming up with a plan. I saw those reports, and my heart goes out to mayors in city like Houston, where people just utterly disregarded any suggestion that there's a deadly virus out there, and we're gathering in mass without mask on. I mean, it's a terrible thing. And I will say, I've said to my team, we are not going to let this happen in Chicago. So if that means slowing things down and taking our time and being thoughtful about the way that we start to reopen, we will do that, because we are not going to undo all the hard work, all the sacrifice that people have literally paid for with their lives. We're not going to allow that to be undone in a moment when people are not thinking and are congregating in ways that we absolutely know is high risk and will lead to hotspots, spread, and death. We're not going to do that.
A question, taking a backward step back to weekend violence, from Craig Dellamore at WBBM Radio. We've seen so many strategies for combating violence after a weekend like this past one. Is there anything that hasn't been tried, anything specific you might have discussed with Superintendent Brown?
Well, as I said, the challenge is the police department is effectively by itself. We have to have our other partners from law enforcement and from social services there. Now, social services there, but obviously a lot of their response has been on COVID specifically. But if there's no credible threat that somebody who is shooting into crowds will actually get arrested and be imprisoned and taken off the street, we have a problem. And so I have been pushing and will continue to push. We've got to open up the courts. We've got to open up the jails for people who are violent and are wreaking havoc in our community. They can't cycle through the system and be back on the street in 24 hours. That is demoralizing to the police. It says to the victims of crime that no one's taking what's happening to them seriously. And so the courts absolutely have to step up.
A question from Politico, and Fran from the Sun-Times had some related questions about the Chicago casino.
Yes.
Now that Chicago has the green light for that, what are the next steps in advancing the Chicago casino? Where is it going to go? Any interested parties? How quickly can it be up and running?
Well, I'm never going to talk about where, and I've been very clear about that. I'm not going to speculate about that, and I'm not going to fuel the speculation. But the next steps roughly are these. We will, now that we have the authorization, the governor obviously has to sign it into law, and we look forward to that. But once the governor signs, we will, and at the start of the process of looking at focus groups and studies and surveys on what, of course, where, but also what amenities people want to see. I see this as a large entertainment district, not just the box of a casino. In order for us to maximize this once-in-a-generation opportunity that the General Assembly has given us, and to maximize the opportunities for revenue, for jobs, long-term economic viability of the city, and of course, to address our pension debt, we've got to be thoughtful and intentional about what we're designing so it's something that attracts people from all over the world. That's what I see. Chicago is a global city. We need a world-class entertainment district of which a casino is a part, but not the entirety of part. So there's a lot of work that needs to be done between now and then, and we're anxious to get started.
I'm sorry.
Last 2 questions, Dana.
I'll let that go for now. ABC 7 question about rats. The CDC says now that restaurants are closed, rats are becoming more aggressive. What is the city doing to address the issue of aggressive rats that have increased during this pandemic?
Well, again, it's not my information that they've increased, but rodent abatement is always something that is top of mind for us. Both through CDPH, but also through streets and sanitation. And here's the thing that I also want to add. With people staying at home, and I know this in my house, you're creating more garbage. Recycle as much as you can, compost whatever you can, but obviously get the compost off the ground, because compost can be a breeding ground for rodents as well. But we also need to make sure that we are securing our garbage cans, putting the garbage in the can, making sure you've got a fully functioning lid. Those are all the things that are important. And then we will continue to step up our enforcement. If you see that there's a particular problem in an alley, in an area, please do call 311, because rodent abatement is something that we always take seriously all year round.
Last question.
From Kelly Bauer at Block Club, what actions will you now take against churches that are holding services, and why are parties and rallies shut down with police help, but churches are only fined? So,
first of all, we're mixing apples and oranges. People out expressing their First Amendment rights is not the same thing as people gathering in the street partying, and is obviously not the same thing as a church. So we allow people to express their First Amendment rights. We admonish them to adhere to social distance guidance, as well as other public health guidance, like actually wearing masks. We can't force people to do that. We're certainly not going to waste precious police resources arresting people who are expressing their First Amendment rights. But as you saw from Saturday, I think it was, when there was a gathering around Buckingham Fountain, they ran their course, and then we made them disperse, and then they did. So lumping everything together doesn't make sense, because they're very separate kinds of events. Regarding the churches, we're going to keep trying to get them to comply, but if they don't, we're going to fine them, and we're going to take more aggressive action. Those ministers who are basically thumbing their nose and putting their parishioners at risk, they can be foolish, but we're not going to, and we will be aggressive in making sure that we get compliance.
Thank you, everyone. Thank you, Mayor.
Thank you.